have different types of fat in our body. Okay, we have like the baby fat. That's brown fat that gets dissolved very easily, and the baby needs it for growing up, and it is good fat. Then we have the white fat, which is fat that has got accumulated, and there's so much fat in the cell that the cell looks white. Now we also have subcutaneous fat. If you pinch the skin, and you can't pinch it because the layer under the skin, right under the skin, is very thick, that kind of subcutaneous fat is usually found in hormonal disorders like thyroid or excessive cortisone in the body, or diabetes, where there is subcutaneous fat. Okay, you can't pinch it. Then you have the abdominal fat, which is not good because it's a high risk for thyroid and diabetes and hypertension. All these causes, the high risk is abdominal fat. Now what is even worse than that is having visceral fat. That is fat around a viscera, around the organs that are there in our abdominal cavity or our chest cavity. That is really not good. Now some of it is okay, but it should not be more than what is needed. One of the things is the fatty liver. Now very amusingly, I must add a few things that we know about fatty liver which are not shared in the regular thing. We know what is good for a fatty liver, but do you know that a fatty liver can also be there if there's deficiency of vitamin D, if there is starvation, if there is deficiency of B12. All these causes can cause fatty liver. Now a fatty liver is a precursor to diabetes again and hypertension. So it is something that we are seeing very often now. Almost all our patients have fatty liver, but it has to be addressed. And the cause has to be found and has to be treated separately.